So to start off the afternoon sessions, we have Katherine Kirkland here with us. She's the Executive Director of the Association of Occupational and Environmental Clinics, the AOEC, as it is up there. It's a clinical organization focused on public health approach to occupational, environmental, human health concerns. A public health approach means prevention and education as much as treatment. Take it away, Katherine.
Thank you. A lot of the work that I've done the last 6-7 years in the Gulf Coast has been sponsored by the Gulf Region Health Outreach Program, which was funded under the medical, under the BP medical settlement. So I have to put up the legal disclaimer, even though the program is now officially over with. I'm still here. I'm still making contacts, maintaining contacts, and I don't have any other things that I need to do. So what we did was, oops, what is AOEC? Well, you heard it briefly in the introduction, but basically we're a clinic network around the United States, Canada, Germany, and a lot of academic programs. And one of the things that people have a problem with is what's the difference between an occupational exposure and what's an environmental exposure? And it's very simple. If you're a first responder and you've been exposed to toxic smoke, you are an occupational exposure. If you're the person living next door to that fire, you are an environmental exposure. The only difference would be that usually the occupational exposures are heavier, more intense, but not necessarily. So what we did was we had the Environmental Health Capacity and Literacy Project. I don't name these things, I just participate. And this was to collaboration between Tulane and AOEC to do outreach and education to clinical health professionals. And you can see that during the course of our grant, we went from west of New Orleans all the way over to Panama City. And it's we worked at the federally qualified health clinics and had interactions. I participated in informal meetings, focus groups, community meetings, health fairs, regional professional meetings, gave me a pretty good idea of what the health concerns are in the region and the diversity of the communities here. And so you have to make sure that, everything, as we mentioned in the breakout group, that it's culturally appropriate in the right language. And a minor thing we found out was, we didn't do it fortunately, but apparently EPA got a bunch of North Vietnamese translators for information they were giving to former South Vietnamese people, and there was just enough cultural difference between those two groups that it caused some issues. Some of the communities are, we have the oil communities, but then when you get over to the Panhandle, you have a lot of them that are service-oriented, that are, their entire business was tourism, not fishing, so, different things. And then one of the things is we found out what their environmental health concerns were. And as you can see, trying to educate, one of the things I've learned, I've worked for AOEC for more than 25 years. And one of the things I've learned is that trying to educate primary care health providers on issues that aren't anything related to what their patients are explaining to them is a losing battle. There's no sense telling them about lead poisoning if they don't see any cases. These are anecdotal, but these are, from all my trips, but these are the sort of things that we did. I made over 40 trips down here. I'm based in the DC area. And it varies a lot on what the information is that people get. Now, the first year, most of the concerns were on Deepwater Horizon, but you'll notice that, over the course of 6 years, those things changed considerably. Dispersants were still a concern. But, not so much. And then we got community member questions. What should pregnant women seafood and how much? And that's, one of those things where you have to be aware of what's going on. I grew up in northern Michigan. If I got shrimp once a month and maybe 4 ounces, if I could beat my brothers to it, I was living high. And, when you talk to some of the communities down here, it's almost staple. And they talked about getting odd questions and what to do. Well, we went to I fortunately had one of my physician friends with me. We went to a meeting in John Lafitte, and the question came up that, 90% of the workers who worked on Exxon Valdez died because of the exposure to dispersing. And we're all sitting, we were sitting there, Lou and I were sitting there going, but we didn't know. It was the first time we'd ever heard that. So we didn't have any fear with saying, look, we don't know, doesn't sound right, we'll check and get back to you. There's never anything wrong with saying, I don't know, I'll get back to you, as long as you get back to them. It's the same thing we found with, I found with reporters. They'll call me up out of the blue and ask a question. It's like, I don't know, but I'll get back to you, and I tell them when I'll get back to them. And that works pretty well. Cancer was a major fear. I had a number of people who said they didn't want to get evaluated because they were afraid they'd find out they had cancer. Children, there aren't a lot of studies, and kids are usually the first thing that people think about. How are my kids going to be affected? Questions not asked. You notice nobody says anything about, well, what are the health effects of the stress I'm under? They're not asking that. And can my unemployment be affecting my blood pressure? They're not asking that. How do I cope with my fear of cancer? Are my children going to be affected by all of the above? Again, the children come in. And it's a real interesting thing. One of the things that was really nice about GRHOP was it was incorporating mental and behavioral health, not only into the primary care setting, but into the schools. Here in Mobile, it was the University of South Alabama did a lot of work with it. And Florida, Western Florida, University of West Florida did a lot of work with it. Louisiana, the same thing. So, this is something that getting it into where the people were, getting it into the primary care health clinics, that has been major. Getting it into the schools, that is major. So you've got to go where the people are. These are the educational modules that we developed. Now, they're mostly for physicians, but we've done, and I don't have the funding, but I can find funding to send people down to talk about things. One of the clinics in the Panhandle at PanCare, none of these topics are what they were interested in. They were interested in ergonomics. They wanted to know how their workers were being affected, and particularly in one case, the dentist and the dental hygienist. So they needed a lecture about that. Well, it wasn't what we were supposed to, we were supposed to be doing occupational environmental health, and the original idea was it would be the oil spill, but no, that's what they wanted. And, now there's a relationship between the clinic and my organization so that when they have other questions, we can get them to ask. But what are the limitations? Well, it's the same thing that we were talking about earlier. You've got to develop trust. It took me several years and multiple trips coming down here as an outsider to get the trust from people. And the staff at a federally qualified health clinic are really, really busy. You want a doctor to listen to you talk about an occupational issue, that's great. But if they're seeing a patient every 10 to 15 minutes, unless it's something related to that patient, they don't really want to hear it. They don't have time. So it's one of those things that you have to, go, like I said, go where they are. And then the other problem with public health are public's beliefs. And this is my favorite quote. I give it to all my public health students. Entrenched belief is never altered by the facts. Now, I'm an optimist. I say rarely altered by the facts. But as I say, we had the question about the Exxon Valdez, they being killed. I went back to union people, and it still took me at least a month of convincing that I'd gone to the right source to convince the people that I was talking to that this was not true. And on the other hand, you also have the problem with, that information about the Exxon Valdez came from an environmental activist, and she was trusted. Well, the problem you have is that sometimes the activists aren't wrong. They're just a little ahead of the game. Back in the early 90s, Theo Coburn came up with the idea that endocrine disruptors were a real problem. And at the time, there were a lot of people who were laughing about it. Oh, you can't have any problem with that. When's the last time you saw a plastic bottle that didn't say no BPA? They turned out that, yeah, actually it was right. And, my organization worked on World Trade Center. Another case of being told, oh no, everything's fine, don't worry about it, the air's safe to breathe. Well, here we are, 18 years later, and we're dealing with cancers, and we're dealing with long-term health effects from people who were exposed at World Trade Center to all that dust. Now, I have to admit, it wasn't something that surprised any of our clinicians. They looked at the dust, they looked at what was in that dust and said, oh, we're going to have problems. So we got started on it earlier. So while we don't think there are any problems with dispersants in the long term, there were a lot of short term, we don't know yet. And there may yet be some, because one of the Johns Hopkins University did a study on dispersants and found out that if you mix dispersants with oil, it can become respirable. Now, only for very short distances, but we don't know yet. So we're kind of, you know, keeping an eye out on what's going on and are not just saying, oh, that there's not a problem. I feel just as strongly we can't deal with people who say it's not a problem as we can with people who say it's killing 90% of the workers. The truth is probably somewhere in the middle, and it's where in the middle. And you've got to have the trust of people before they'll believe you. So we can't say, no, there's no problem, because we don't know for sure. We can't say, yes, there is a problem, because we don't know for sure. And so we have to say there's uncertainty. And sometimes that's not an easy message for people to get. Now, why don't our primary care physicians know about this stuff? Well, you know, they don't get it in medical school. And as I said, they're all extremely busy. Median medical school curriculum time for occupational environmental health in '91 was six hours. It hasn't changed. Some schools will offer a little bit more, some won't. And then some of you were asking about local sources for information. Well, there aren't. And it's not just here. If you're looking for occupational environmental physicians, there is no recognized specialty in environmental health. It's taken care of by the toxicologists, the emergency room doctors, and the occupational physicians. The toxicologists tend to do blood tests and urine tests and that sort of thing. The ER docs are taking care of the acute exposures, and the OC docs, as we call them, are taking care of the long-term low-dose exposures. But this is your how many board-certified occupational physicians per population. You'll notice, you know, Washington State, 56,000. Florida, 129,000. Alabama, 1 per 149,000. Well, part of the reason why Alabama has a, you know, I mean, it's a lot of, and a lot of those are military people. Florida has a really good, you know, for its population and so forth. They're not doing too bad. That's because there's a whole lot of retired occupational physicians in Florida, a whole lot of military physicians in Florida. So they're not really any better than the rest of them. They're, you know, if you're talking active occupational physicians, we're probably talking more in the 155 range. So what do we offer to the response? And I'm taking this as a total bragging point. If you have questions, if you know of a clinician who has a question, you can contact my office and I will put you in touch with a physician or a training program that can answer the questions. This is what I do. You know, this is what our organization does. The other resource that I found out at the Sea Grant meeting in Virginia that nobody seemed to know about was CDC and EPA actually fund the pediatric environmental health specialty units. Now these are 1 per region clinics that focus strictly on children and families. And so if you've got a question, there's been an oil spill in Virginia Beach, they were talking about the Oceana jet fuel leak. And people were worried about their kids and asthma. These are the folks who can answer your questions. Now the real trick is they, in their infinite wisdom, decided to split the group into two, you know, and they split the country in half. So if you're in Louisiana, you have to call the region 6 to 10. You have to call that number. If you're on this side, you're region 4, and you call the other number. And if you're really totally confused, call me because I keep track of them. And one thing that somebody was also brought up in the Virginia meeting was, you know, how do we get information out? If we've got information about a health concern related to a spill, how do we get that information out? How do we get out the information that if you're, you know, if you're a clinician and you're seeing X, Y, and Z symptoms, is it possibly related? And so there is a, CDC does have a information exchange called EpiX. And it's usually being used for infectious disease. But it also works for occupational disease, and it also works for, some other things. So the nice thing about EpiX is, while it's not universal, all physicians don't belong to it or anything, almost all of your health departments do. And so if there's a problem and we can find out about it, we can get CDC involved, any one of the CDC agencies, we can get it out to the health departments through EpiX. Thank you. And so this is a real good thing to have, and to know that it's there. And again, I'm not the person who can get it posted, but if you've got something you want posted and you can't figure out how to get through the CDC bureaucracy, again, call my office. We've been working with them for 30 years. We're pretty good at the CDC bureaucracy at this point. So with that, that's how you get in touch with me. It's kkirkland@aoec.org. It's real simple. I check my email on my phone. It's things I did learn how to do with my smartphone. And we do have a toll-free number as well as our regular number if you're in one of those offices where you can't call toll-free numbers, which I found occasionally happens. And I have to acknowledge my colleagues at Tulane because the first, like I say, the 6 years we were working with GR Hub, these were the people I was working with who are great, and they're still in the area. And then this is my favorite picture. This was taken in 2015 in Jean Lafitte, looking out over Bayou, over Barataria, not the bay, well, anyway, and the shrimp boats. And I use this when I'm talking to people who aren't in the Gulf Coast to say, this is how close the boats are to the water. This is where these people live and work, and we've got to take care of it. So thank you.